Welcome to this edition of Healthy Living. I'm your host, Tim Kelly, joined today by Dr. Nancy Welch, the Acting Director of the Western Tidewater Health District. Thanks for being with us.
Oh, good to be here. Thank you.
Today's topic is certainly one that we've heard a lot about lately,
Yes.
the Ebola virus disease. I think the first question I'd like to know is, what exactly are we talking about when we talk about Ebola?
Yeah. Ebola is one of about 30 different viruses that can cause hemorrhagic disease. That's the picture that people think of when they think of Ebola, is the individual who is severely ill and hemorrhaging.
Right.
That certainly is the severe case. So it is one of 30 viruses that can cause it. It is a disease that we have had occur in countries in the past, but never to this extent.
Mm-hmm. Now, when we're talking about Ebola again, we have the definition, but what are some of the symptoms?
Mm-hmm.
And I know there's a variety of them. You talk about it's part of a bigger family.
Correct.
Therefore, there's going to be some similarities and symptoms among all the different
Right.
things that fall into that category. But specifically Ebola, if someone is thinking, just thinking about it or symptoms, what are we talking about?
Well, first and foremost, you have to be exposed.
Correct.
And you have to be exposed in a way that can transmit the disease. The mere presence of the germ is not consistent with it spreading.
Right.
So you have to be directly exposed to body fluids,
Mm-hmm.
and that's key. It's not airborne.
Right.
There are lots of other germs that are airborne. Measles, influenzas come up to mind.
Mm-hmm.
But this is not airborne.
Okay.
So you have to be directly exposed to body fluids. And that can mean saliva, blood, vomitus, diarrhea, semen. So there are different body fluids that can transmit it.
Right.
And then there's an incubation period. An incubation period is a time when you've been exposed to the germ until you develop the symptoms. And that maybe is an average of about 8 days, but it can go all the way out to 21
Okay.
for this particular virus. So, and during that incubation period, and this is another incredibly important thing to note
Mm-hmm.
with the Ebola, is that while you are incubating it, before you have any symptoms, you are not contagious.
Correct.
So you are only contagious when you have the actual disease symptoms.
Okay.
And again, that's an incredibly important thing from a public health perspective, and in contrast to influenza and measles again,
Sure.
where you can actually spread the germ, make others sick by just casual contact and before you have any symptoms. Not the case with Ebola. You have to have symptoms. Now, the symptoms include, they're pretty generic symptoms, so
Right.
the first part of it is if you've been exposed, meaning in today's time, have you been to West Africa where they have the disease?
Right.
Have you been exposed to someone who has the disease? And then within this time frame, maximum of 21 days, developing fever, joint pain, feeling just really very bad, decreased energy, may develop vomiting then, may develop diarrhea, and it then can progress to hemorrhaging.
Now, we talk about the symptoms and you talk about the transmission methods and the fact, again, I think the key point, again, as you noted as being a key point, was the fact that unless you're exhibiting symptoms, you're not able to spread the disease, correct?
Correct.
And again, that's something to be aware of. So
From
again,
a public health
right.
perspective, it's essential to be aware of that.
Correct.
Because we certainly investigate numerous communicable diseases,
Right.
a lot required by law.
Sure.
And it's important for us to understand that distinction between incubation,
Mm-hmm.
which is the time from exposure until the time you actually develop symptoms,
Right.
and contagiousness, which is the time when you can actually spread it to other people. And that's a key point that we utilize in investigating any kinds of contacts or any kind of exposure. And with Ebola, it's a very serious disease. Absolutely, don't get me wrong
Correct.
with my subsequent statement, which is to say that it is also less contagious
Right.
because it is not airborne and you can only spread it by direct contact with bodily fluids.
Right.
And you can only spread it when you have symptoms. So in that regard, it's actually harder to catch than, say, flu or measles.
Because again, you could be a carrier even though you don't have any symptoms per se.
Well, I wouldn't call it a carrier.
Well,
Medically, that's a little distinction, but
Sure,
you can have
sure.
the germ in your system.
Correct, correct.
And you have not developed the disease, and therefore you are not contagious. And that is an incredibly important point. And the other very important point, people hear that and they say, well, then why do they have so many cases
Correct.
over in the country? Well, you cannot compare West Africa with the United States.
Right.
It's comparing apples and oranges for a number of reasons. One, our means to be able to do protection control, infectious disease control, far surpasses what you see in West Africa.
Right.
We have adequate supplies, we have adequate gloves, we have adequate kinds of gowns, we have adequate kinds of face protection, and we don't have to wash them or reuse them.
Right.
We have adequate supplies, and our healthcare workers and our personnel are all trained in how to use that. In fact, they're going through retraining as
Correct.
we speak, so that they can be sure they have the technique down very, very well. So that is important, that we have the supplies, we have the training, we have isolation rooms.
Right.
They don't have that over there. A number of the facilities where these people went had dirt floors. So there's no way you can do an isolation facility, nothing compared to our systems we have here, where we have designated rooms. We have them set up in special ways to avoid the germ moving around, so to speak, or getting on other people. So that is incredibly important to recognize that. We also have much more extensive means of doing investigation for those who may be exposed. And our epidemiologists in each of the health departments and working with infectious disease people at the hospital are very skilled and accustomed to doing investigations. And we're on call 24/7. So believe you me, we are getting the calls.
Correct.
And that's good.
Right.
We want that. But they're very skilled at investigating to determine if the person has the disease, if they have exposed anyone, and then we make decisions from that. So they don't have that means over there.
Sure.
They don't have the numbers, they don't have the capabilities, they don't have the skills. And then combine it with the fact also of some of their cultural differences over there as opposed to over here, which puts them at much greater risk, even in terms of their burial considerations, puts them at much greater risk than what we see here.
Anything that someone watching this program, I mean, is it really come down to basic, you wash your hands, sanitizer type thing with regard to just some, because some people I'm sure are thinking, what can I do to help myself, if I come in contact with someone, granted you know people in your life, and obviously you probably would know to a certain degree what their health condition are, but we come in contact with strangers throughout the course of the day, or come behind people, and certainly not to make people germaphobes or something like that, but more of a sense of just some basic things that we should be doing, which may go beyond this onto other things. We talk about it during flu season and things like that. I would relate it to that to a certain degree, but does the same theory apply when we're talking about this on some basic level?
Well, it's a wonderful segue. I'm glad you mentioned flu, because a lot of the sort of inferences you're making and relate to general kind of preventive measures.
Right.
Those measures, hand washing, just basic hand washing, precautionary measures, wiping even grocery carts when you go in because you don't know who's been exposed, wiping door handles, and what we work with schools in terms of students using hand sanitizer when they go to computers. Those are measures that are incredibly valuable and make a difference on the diseases that can be transmitted by casual contact.
Okay.
That gets into your influenza, your colds, your
Right.
respiratory, your airborne. Those are measures that we emphasize time and time again because it's casual contact. You don't know when you're really necessarily being exposed because they can be transmitting the disease before they have any symptoms.
Correct.
So that's most applicable in those situations.
Right.
Remember, Ebola cannot be transmitted casually. You have to have direct contact with the body fluids, and it can only be transmitted when the person is sick. So the preventive measures you mentioned, please do them.
Correct.
It's going to primarily keep you from getting influenza and different respiratory illnesses that occur this time of year. Now, if indeed you are exposed to someone who has come from West Africa, has the symptoms of Ebola, then yes, we'll be working with you. I can guarantee you will see the health department.
Right.
And we will be working with any contacts
Okay.
in terms of the types of measures that they take. The question that will be when we check with those individuals and those contacts will be to discern what kind of contact they've had.
Correct.
And therefore what kind of risk, and that's going to entail more intensive questioning.
understand. Now, when we talk about someone who's been diagnosed or has Ebola symptoms or has been classified as having the virus, treatment, I mean, I know you hear about experimental drugs and things like that. What is the situation with regard to treatment from what you've been led to believe? And certainly education is the biggest key component throughout anything we're talking about, both for healthcare providers as well as for the general population as well. But just what is out there as far as in the means of treatment or concrete? I mean,
the main treatment actually is supportive,
okay.
detecting it early and providing supportive treatment, because the problem with Ebola is that it hinders the integrity of your vessels and of the cells of your tissues, and so that predisposes to having organ failure, of having hemorrhaging, going into shock. So the main treatment is, from a medical perspective, monitoring all of those parameters so you can detect any of those medical changes early and provide interventions, which is primarily not so much medication per se, like an antibiotic for a strep infection or something, but it's primarily more related to fluids or electrolytes or things that can maintain your stable state. Now, yes, there are some experimental medications that we've heard about, certainly with the individuals who have come across. They're not widely available at this point. They are indeed still experimental. But so the main treatment is early detection, which is why it's fine that people call us from the healthcare centers or when they have people come to the emergency room, so that we can make some consideration early.
Correct.
So that we can decide if they need to go ahead and implement admission and precautions and treatment early, so we can avoid these other kinds of problems from occurring. But the main treatment right now is detecting it early, at least what we can do here in the States.
Sure.
Not so much so that they can do in West Africa, but what we can do here in the States is detecting early and provide the supportive care, the IVs, the electrolytes, monitoring their kidneys, their different organ functions, so we can respond to that appropriately and treat them.
Okay. When we're talking about the Department of Health, the Virginia Department of Health, what is going on as far as within the organization to prepare for any possible response at this point? Certainly, again, education is the key, making sure the information is out there to everyone, whatever level or role you play in the medical or just being alive and living in the state of Virginia, so to speak. But what is going on at that level? What conversations are you having?
Lots. A lot from both the central office and from the local level. The central office has been very proactive in sending communications to all of the healthcare providers and to the healthcare facilities. So we receive them at least on a weekly basis, and often more than that, to keep the entire communities abreast of what's occurring. So the central office for the Department of Health is being proactive in distributing that information so that people can be suspicious. It can be on their mind, but they need to be suspicious based on some specific criteria so that we don't run ragged on people who've never even been to West Africa, for example. So we do have some criteria on that, but they've been very proactive. We've also been very proactive in terms of our availability and communicating with our local people, and that's true in each one of the health districts. And we've certainly have and continue to do presentations at different groups, the epidemiologist and myself. And we have put information up on websites so that people can have the information. There are some nice algorithms which we've distributed to healthcare providers and have available on our website. And certainly from the federal perspective, and it's not in Virginia per se, but D.C., I'm sure you heard about the increased kind of surveillance that's occurring at the 5 airports. And yes, D.C. is not Virginia, but it's our neighbor.
That's correct.
So it might as well be Virginia. A lot of our Virginians arrive that way, so through D.C. So we work very closely with that. And I will say that there is an excellent communication with our state and at the local level so that we're made aware 24/7, as I said. We carry our phone with us of any kinds of suspicions or any kinds of follow-up. The epidemiologists meet on a regular basis. They're communicating both by email, by phone. I just, before this interview, in fact, just completed a conference call that was statewide with all of the VDH personnel for us to receive an update, to remind us about the procedures for the testing and how to work with the physicians for any of those procedures, and to remind us about what's being done in terms of the monitoring, to remind us about if anyone needed quarantine or isolation, some of the criteria on that. So we are receiving, I'd probably say daily, communications on some of those things by email, and then at least once a week there's some kind of a conference call or something that one of us is engaged in.
Okay. Well, Dr. Welch, I want to thank you for joining us to talk about Ebola and sort of the A to Z, so to speak, as far as where we are at this point. And again, knowing that the Department of Health is meeting, is discussing, is preparing in the event of any possible needed response. But certainly, again, it's just, again, the education part about what we're dealing with as far as how it's transmitted, and also, again, you know, symptoms and treatment and the whole ball right there. But again, I appreciate your time. If someone watching the program would like more information, now you mentioned websites, and there's a lot of great ones out there. Certainly, we'll have some of those addresses on the screen. Are there any contact numbers or a number you might say if someone had general questions? Is there a good reference point, or perhaps even their personal physician?
Well, actually, a personal physician certainly is one, but a good place is to go to the VDH state website, and they have lots of information on their website, or the CDC website, and again, you just Google. Everybody's used to Googling nowadays, so just Google CDC or Virginia Department of Health. And most of the information that we have on our websites at the local level, we are extracting from those two resources. So those are going to be the two main ones. They are our guiding light here in terms of steering us towards some consistency that is also relevant to the means by which it's transmitted and the resources. But I would recommend CDC. And you can just put in CDC. You don't even have to remember Center for Disease Control, just CDC, and the Virginia Department of Health, or VDH, and you'll have more than enough to keep you reading.
Good deal. Okay. Well, thank you again for that. Again, we appreciate you joining us for today's program on healthy living. I'm your host, Tim Kelly. We'll see you next time.
Thank you.